based on up-to-date medical literature. It is meant to be comprehensive. However, your experience or the experience of your healthcare provider may be different in one or more ways. Welcome to this educational MD conversation module. This module should be thought discusses of as educational tools and how they are not meant to provide this presentation advice is based on up-to-date medical literature. It is meant to be comprehensive. To view this presentation, however, as many times as you wish, or the experience of your healthcare provider on your left may be different in one particular slide, or to skip through them in any order you wish. MD conversation modules should be thought of as educational tools. Surgery is used to repair a hydrosel. They are not meant to provide specific advice. It is a relatively minor procedure or influence the choices you make and a high rate of success. Please feel free to view this presentation as many times as you wish. Most often, you may also use the player on your left. It is a congenital condition slide, which means that it is present in any order you wish. A hydrosel is used to repair a hydrosel. The sac is a relatively minor procedure. It is caused by a collection of fluid around the testicle. Hydrosels almost always occurs on one side most often baby boys. And the condition in newborns is almost always benign, which means that cancer is not a concern. There are two types of hydrosel. A hydrosel is a swelling in the communicating hydrosel, the sac containing the testicles. The other is a non-communicating collection of fluid around the testicle. This illustration almost always shows the normal male side only, as they are seen condition in newborns is almost always benign. If you look at the top of the scrotum and the testicle is not a concern, you will see that there is a connection to the abdominal hydrosels. The testicles develop within the abdomen and remain there until the 8th month of pregnancy, when they begin to travel down into the scrotum. This illustration shows the normal male genitals. The testicles drop from one side from the abdomen. If you look at the top of the scrotum and the testicles, a fluid-filled sac that there is a connection to the abdominal cavity surrounds each testicle developed within the abdomen at birth and remain there until the 8th month flows back into the abdomen. When they begin to travel down, the opening between the abdomen and the scrotum closes. The testicles drop into the scrotum from the abdomen through a muscular ring. The purpose of this sac is to produce a small amount of vaginalis to lubricate and protect the testicle. At birth, or soon after, it is common for some fluid to remain in the abdomen. After the opening to the abdomen between the abdomen and the scrotum research shows leaving that this is more common when a baby boy is born prematurely. Most of the time, purpose of this there is neither pain to produce a small amount of fluid with this to lubricate and protect the fluid is simply absorbed by the body within a year. It is common for some fluid to remain in the scrotum. In this case, the opening to the abdomen a non-communicating hydrosel. Research shows that this is more common when a baby boy is born prematurely. A non-communicating hydrosel. Most of the time, there is neither pain nor between the abdomen and the scrotum is closed. The fluid is simply absorbed by the body within a year by the time the baby is 12 to 18 months old. In this case, it is called a non-communicating hydrosel. Most hydrosels that shows longer than 12 to 18 months are communicating. You can see that the opening between the abdomen and the scrotum is closed. In these cases, there is a persistent opening. The fluid will be absorbed by the time the baby is 12 to 18 months old. Processes vaginalis. No treatment will be necessary. Sometimes it has never closed. Other times, most hydrosels that persist longer than 12 to 18 months are communicating in either instance non-communicating fluid that flows into the scrotum from the abdomen. There is a persistent opening between the scrotum and the abdomen. These usually occur on one side only. Processes vaginalis. An intervention is usually required to fix them. It has never closed, as they essentially represent a small hernia into the groin, then reopened for reasons that are not understood. This slide shows a communicating hydrosel. Fluid that flows into the scrotum from the abdomen causes the swelling around the scrotum into the abdomen. These usually occur on one side only. An intervention is usually required to fix them, as they essentially represent a small hernia into the groin, but it is usually not severe. This slide shows a communicating hydrosel. Note the patent hydrosel feels like a balloon that is filled with water. The scrotum into the abdomen during the night remains open. It generally becomes smaller. Then, when the child is rarely cause pain, it increases in size. In some cases, this change is one of the things but it is usually not a non-communicating hydrosel, nor do they damage the testicles in any way. If the opening between the abdomen and the testicles is filled with water, fluid cannot get in or out. It generally becomes smaller. Then, when the child is active, the hydrosel is communicating. There are several ways to confirm the diagnosis. That distinguishes a non-communicating hydrosel from a communicating hydrosel. If the opening between the abdomen and the testicles is closed, the fluid is clear. Fluid cannot get in or out. Transillumination. If a physician suspects that the hydrosel is rarely done as part of the workup, there are several ways to confirm the diagnosis. The first infancy, an examination is not recommended, feeling that most hydrosels are non-communicating against and will go away with time as the child grows. This is called transillumination at age 1 to 2 years. Ultrasound when a hydrocele and lab testing and is felt rarely to be done as part of the workup for hydroceles. Surgery is the recommended
during
treatment,
infancy,
and as mentioned, is not recommended. It is usually performed as most hydrocele is around the age of 1 or 2 years and will go away with time. Surgery as the child may be performed through a small cut in the skin is recommended in the lower at age 1 to 2 years. When a hydrocele persists, it is important to note and is felt that in the pediatric age group, needle aspiration surgery is the recommended treatment. And as mentioned, it is usually performed repair of a hydrocele is around the age of 1 or 2 years. It is not a complex procedure through a small cut and is always done in the lower abdomen or groin area. It is important to note that in the pediatric age group, after a general anesthetic is administered, are never to be performed. An incision or cut is made. Surgical repair of a hydrocele is called hydrocelectomy. First, it is not a complex procedure to the abdomen. It is almost always done vaginalis on an outpatient identified. The fluid is then traditional open and the opening is closed off. After a general anesthetic is administered, the incision is closed. An incision self-dissolving stitches, most often into the groin area. When you arrive at the hospital in the morning, first, blood and the urine samples from the scrotum may be taken. The abdomen, in rare cases, the processus vaginalis, in some cases, identified. You will be able to remain with your child is then removed until the anesthetic opening is closed and he falls asleep. Finally, the procedure itself is closed generally takes about 30 minutes. When the operation is completed in the morning, your child blood and urine samples may be taken, usually for about 2 hours. In some cases, in the recovery room, you'll be able to remain with your child and the wound is inspected to make sure there is no unusual bleeding. The procedure itself, pain medication is given about 30 minutes, and your surgeon will advise you about the need for medication. When the operation is completed, your child will be moved there to the recovery room and tenderness around the wound 2 hours, as well as some swelling in the recovery room. Blood pressure is checked, and the wound is inspected to make sure, since there is no unusual stitches are used, your physician will not have to remove them, and your surgeon will advise you about the need for medication once you are back for 2 days. It's normal for there to be a little bruising and tenderness around the wound 4 to 7 days, as well as some swelling in the area. Are using straddle toys, such as bikes and rocking horses. Since self-dissolving stitches are used 3 weeks, your physician will not have to remove them. Complications after a hydrocele wound from getting wet very rare. For 2 days. They may include most normal activities or a collection of blood in the groin 4 to 7 days. Exceptions are using straddle toys, damage to the blood supply of the testicle, and rocking horses. These should be avoided for about 3 weeks. Your surgeon will explain what signs to watch for, including complications after a hydrocele repair are very rare. Fever or redness around the wound, bleeding, or a collection of blood in the groin called an hematoma. You should notify your physician damage to the blood supply of the testicle. The success rate for hydrocele repair what signs to watch extremely high, including swelling, and the chance of the condition reappearing is rare. Fever or redness around the wound. A hydrocele is a collection of fluid in the scrotum around a testicle. You should notify your physician in newborn males, signs but most are non-communicating hydroceles. The success rate for hydrocele repair is extremely high. Surgical correction of the condition for hydrocele is rare. Usually communicating ones. In summary, not resolved a hydrocele is a collection of fluid in the scrotum around a testicle. Is a simple outpatient procedure males with low risk. Most are non-communicating hydroceles, which will go away as the child grows. These resources may help you find further information is required for hydrocele about your child's condition, communicating ones that have not resolved by age 1 to 2. Surgical treatment of hydrocele sincerely hope is that this module has furthered your understanding of hydrocele and a high success hydrocele repair. We wish you the best for the future resources and thank you once again for further information or support about your child's condition. We sincerely hope that this module has furthered your understanding of hydroceles and hydrocele repair. We wish you the best for the future and thank you once again for viewing this educational program.